Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McRae.
During knee replacement surgery, damaged bone and cartilage is resurfaced, and it's done with metal and plastic components. In a procedure called unicompartmental or partial knee replacement, only a portion of the knee is resurfaced.
It sounds like it would be tricky.
Well, if you're an orthopedic surgeon at the Mayo Clinic, it's a piece of cake.
Okay. The operation is an alternative to total knee replacement for patients whose disease is limited to just one area of the knee. And here to talk about the indications for the procedure and the recovery is the chairman of the Department of Orthopedic Surgery at Mayo Clinic in Rochester, Dr. Mark Pagnano. Welcome to the program.
Thank you very much. It's a pleasure to be here.
Dr. Pagnano, nice to see you. Thanks for coming. So let's talk about, in general, about knee replacement surgery. Why is it done? What are the most common indications?
Sure. Knee replacement is typically done for patients who have advanced arthritis of the knee joint, and that can either be arthritis from wear and tear, just from years of use, or from other causes like inflammatory arthritis.
And when you do that, most of the time, the entire joint is involved, or the majority of the joint, so you resurface everything. But if only a portion of the joint is involved, you can do a lesser surgery and replace only the damaged portion.
That's right. For a selected subgroup of patients, they only wear out one of the three major parts of the knee joint. And if they have disabling pain and just one part of the knee joint that's worn out, then a partial knee replacement is actually a very reasonable option for them.
How can you know until you get in there that a partial surgery would work? Is there an x-ray? Does x-ray show it, or how do you see?
Yeah, so the good news is with some specific x-rays, you can largely determine whether a patient is in fact a candidate for a partial knee replacement. So it does take the guesswork out of it. It would be exceptionally uncommon, in my experience, to go into the knee and be surprised at the findings. So a partial knee is determined before the time of the operation.
You talked about three compartments to the knee. What are those?
Yeah, so the best way to think about it is the inside or medial compartment, the outside of the knee or lateral compartment, and then the kneecap or patellofemoral joint. So three parts.
And that the patellofemoral joint, the joint between the kneecap and the underlying thigh bone.
That's correct.
Out of those three compartments, which one is usually where you end up for when you just do a minimally invasive one?
So the most common is a medial compartment partial knee. So the vast majority of people that have degenerative arthritis of the knee wear out the inside part first, and then the other parts kind of follow. It is possible in certain circumstances to wear out the outside part or the patella selectively, but that's much less common.
If you wear out just the inside part of the knee joint, you might be bow-legged, right?
That's correct.
Now, this is almost deja vu, because years ago, a decade or two ago, when I was still doing joint replacements, we did some unicompartmental knee replacements, partial knee replacements, and it seems like they didn't work out so well. So what's different today? How did they come back into vogue?
Yeah, so I think two major factors. One is that years ago, partial knees were used for reasons that were not appropriate. So people tried to expand the use of them. And the second was that a partial knee is technically a harder operation to do for the surgeon. And there have been advancements with technology and technique that make it more reliable, more reproducible, and more durable.
The instrumentation is much better, for sure. We did a lot of it freehand.
Yeah, and today the big thing in partial knee replacement is either computer navigation or robotics actually to help with that. So the precision of the surgery has been markedly improved, and that seems to have an effect for the outcome.
Let's talk pros and cons. What are the advantages and disadvantages of doing a partial knee?
Certainly. So what I typically think about is that partial knee is a smaller operation. It typically results in a quicker recovery, and then typically also has a little bit better function than a total knee replacement for patients.
And that's partly because you're able to preserve the patient's own ligaments, which is a big deal.
That's right. So in every total knee replacement, we have to remove one or perhaps two of the major ligaments to provide stability to the knee. And in a partial knee, we get to keep all of those ligaments. So the way the knee bends and straightens after surgery is closer to normal with a partial knee.
You said it's a little more difficult surgery to do. Are there any disadvantages?
So the biggest disadvantage would be that it is possible at a later date to wear out one of the other parts of your knee and perhaps require conversion of the partial knee to a total knee. But it's also important to recognize that the intention with a partial knee replacement is to have that last as long as possible. So for most patients, a partial knee replacement will in fact last them the rest of their life. But it is possible that you might require another surgery.
So tell us about the surgery itself. How do you do it? Is the patient asleep, and do you do it under a tourniquet?
Yeah, so today there have been some major advancements from a patient perspective in knee replacement surgery. And one of those is advancements in all we do around the time of surgery. So today, most patients with a partial knee will have that done as an outpatient surgery, so they can come in and go home the same day. Most will have it done under spinal anesthesia, so they can be breathing throughout the whole surgery. And most will be able to bear weight, start walking immediately after the operation.
Really? So no crutches or cane afterwards?
Most patients will start with some kind of walking aid, either a walker or crutches to start with, but can quickly transition. They can, however, put weight on it immediately after surgery.
Are these components cemented or no?
They are cemented into place, so cement for knee replacement continues to have an outstanding track record, and that's one of the advantages. Because the parts are bonded to the bone securely at the time of surgery, then we're very comfortable with letting patients bear weight immediately following the operation.
I just want to clarify something. So you said if you don't have the surgery, maybe the second joint then starts to degrade or suffer, and then possibly the third. So that's the benefit of doing just this first surgery on the inside part of the knee. So if you do that surgery, if you do this partial knee, then why isn't it that pretty soon you have to do a partial knee on the outside? I mean, it would seem like if it's going to continue to degenerate, that then the other part would need to be partially done as well.
Yeah, so for the majority of patients, once we realign the knee and restore stability with the partial knee replacement, then the knee continues to function well. And so the chance of wearing out those other parts of the knee go down over time.
See, the non-orthopedic person had to clarify that.
You got it. Well, and he did a great job of clarifying it. So I know we don't necessarily like to talk about this part of our profession and the surgery that we do, but there are always complications. And what are those when it comes to partial knee replacement?
So with partial knee replacement, the typical complications would be similar to the ones we would see with total knee replacement. So those would include infection, bleeding, nerve trouble, blood clots. Now, the chance of running into any one of those complications is relatively low, but obviously for any one patient, that's a big deal. But we're able to take specific precautions to really minimize the risk of that. And one of the advantages of partial knee is that for each of those complications, the risk is about half of what it is with a total knee replacement.
Wow, half a knee instead of whole knee.
Holy moly.
All right, Dr. Mark Pagnano, Chairman of the Department of Orthopedic Surgery at Mayo Clinic in Rochester.
Hold on. Have you gotten along without Dr. Shives? He's been retired now for over half a year. What are you doing in your department without him?
Yeah, we are struggling, but we're going to make it.
So if you need a knee replacement, usually for arthritis, there are advantages to having a partial knee replacement. If only a portion of the joint is involved, it's a quicker recovery, it's less pain, it's less blood loss, and usually better function. No reason to replace a portion of the joint, I guess, if it doesn't need it. Dr. Mark Pagnano, thanks so much for being with us.
Thank you so much.